Hi, I'm Steve Adubato. Welcome to the Tisch WNET studio here in the heart of Manhattan, Lincoln Center. It is our honor and pleasure to welcome Dr. Sonia Tolani, Assistant Professor of Medicine, Columbia University Medical Center. Good to see you, Doctor.
Good to see you, too. Thanks for having me.
It's our pleasure. We're here to talk about women, cardiovascular disease, the #1 killer of women in this country. Most people know that or don't know it?
Don't know it. And not only is it the #1 killer, it kills 2 to 3 times more than breast cancer, cervical cancer, Alzheimer's, basically all the cancers together. If you look back in the early 2000s, only about 15% of women knew that heart disease was the #1 killer. You look last year, we're only up to 50%. So you've got half of women not understanding that the most important reason and thing that they need to worry about is their heart health.
So let's do this. Let's break down some of the most significant, quote-unquote, risk factors for women.
Sure. So we have traditional risk factors for everybody, and those are diabetes, high blood pressure, high cholesterol, smoking, and having a family history of someone having a heart attack or a stroke at a young age. Women have those same risk factors. Some of them happen to be even more deadly for women. So while diabetes doubles the risk of having heart disease for a man, it triples the risk for having heart disease.
Triples?
For a woman, right. And smoking, bad for everybody, but about 25% more deadly for women than for men. On top of that, we have other risk factors that we're just learning about and understanding in the last couple of years that make women more susceptible to having heart disease.
Sure.
So complications during pregnancy, something called preeclampsia is...
Preeclampsia.
Preeclampsia. So that is a disorder of pregnancy where the mother, the woman carrying the child, gets very high blood pressure. Even if they have minor increases in their high blood pressure, any high blood pressure during pregnancy at all, or any diabetes during pregnancy at all, increases the risk that a woman's going to have a heart attack later on in life. Because pregnancy is sort of a stress test that your body is going through. And having high blood pressure or diabetes during that period of time is a marker that that woman is at risk for having heart disease later on in life.
Doctor, let me ask you, for you as a physician, two-part question. First of all, when did you decide to go into medicine? And I'll ask you about your specialty.
Sure. So for me, I actually decided I wanted to be a doctor very, very young. You know, my parents...
How young?
I would say maybe grade school.
Really?
Though if you look back, I think in 3rd grade I wrote that I wanted to be a figure skater. I think.
Was this in Indiana?
This was in Indiana.
Okay.
My parents immigrated from India, and so growing up, the work ethic was to study hard and be the best that you can be. And in our community, the people that were the most esteemed, the people that we trusted the most, that we thought were the smartest, were doctors. And so the ultimate goal was to become a doctor. And that's sort of from a very early age where I wanted to be.
Where does cardiology come into it?
Cardiology came into it because, I'm a very ordered person. I like things to all make sense. So, cardiology, your heart is really a pump. It's a very simple organ. It provides the entire sustenance for your life, but it's really pipes. And it's physics, and it all makes sense. And there's so much that we can do for people with heart disease. For me, knowing that 90% of heart disease could be reduced by just addressing people's risk factors, to know that you have the power to really, truly, make people live longer, healthier lives, I think it's a wonderful opportunity.
The app, is it called Love My Heart?
Love My Heart.
What is it? Make sense of it for us.
So it actually came out from a colleague of mine, who's also a woman cardiologist, realizing that women don't know what their risk is for heart disease. And the other problem with this is that healthcare providers are not doing a good enough job of telling women about their risk.
What do you mean?
So 80% of women from age, say, 40 to 70 have some risk factor for heart disease. Only about 16% have had their healthcare provider talk to them about their risk. And so if we know that heart disease can be prevented by addressing the risk factors, Why are we not speaking to women about the risk factors so that they can have a chance to eat better, exercise more, take medications if they need to? So the
how does the app
starts off with a 5-minute risk calculator. You put your information in, your height, your weight, a little bit about your history, your pregnancy history, and at the end of it, you get basically a score. And it tells you whether you're in ideal health, where you have a medium risk, or you have a high risk. And the great thing about it, it's all based on studies done by the American Heart Association about women's heart disease. And unlike the myriad of things that are out there, it's vetted, it's simple, and it gives you the information that you need. Am I at risk? And you can do this without any doctors, without talking to anybody about it. And once you get your risk, the app will also give you a plan to help you learn how to be healthier. So if you have high blood pressure, we'll give you some information about how to lower salt in your diet, and different things like that.
Real quick, before I lay out, when should women start thinking about their hearts?
Anytime, really. We think at least starting in your 30s. So where heart disease is going down in every single demographic, the one demographic where it's going up are women aged 30 to 45.
Going up.
It's going up. So really, women should be thinking about it the minute they become adults.
Dr. Sonia Tolani, Assistant Professor of Medicine, Columbia University Medical Center, Women, Cardiovascular Health. You gave extremely important information to a lot of women watching out there on public television, Fios, all of our audiences. I want to thank you so much.
Thank you so much for having me.
Well done. It's good public service.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by TD Bank, the New Jersey Education Association, New Jersey Council of County Colleges, Summit Medical Group, MD Advantage Insurance Company of New Jersey, the Northward Center, and by Fedway Associates. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.